Welcome all. So we continue with the purpurium itself. The next topic is a lactation. So this is also a very important topic from the examination point of view. Either there can be a short note or even the long question has been asked on this particular topic. So short notes such as colostrum, composition of the breast milk, lactogenesis, galactopoiesis, milk letdown reflex, galactagogues, lactation failure, lactation suppression. So these are the various short notes which can be asked. Then there can be long essay like physiology of lactation or hormonal regulation of lactation, advantages of breastfeeding, management of lactation failure. So these are the things which can be asked on this particular topic. So what is lactation? So lactation is a physiological process by which mammary glands synthesize, secrete and eject milk to nourish the newborn. So three things are happening: synthesis of the milk, secretion of the milk and ejection of the milk. Okay. So it's a physiological process by which mammary glands synthesize, secrete, and eject the milk to nourish the newborn. So next is a colostrum. So what is colostrum? Colostrum is the first breast secretion produced during the pregnancy and in the first few days after the delivery. Okay. So the colostrum can get secreted even during the pregnancy, latter part of the pregnancy also, but after the delivery, whatever is the first, that we call the colostrum. So color is a deep yellow. The composition of the colostrum, this also you should know, or you should write if there is a short note. It's a deep yellow in color, serous in consistency, alkaline in reaction, and specific gravity is high. It has got a high protein content and low fat content, low carbohydrate content. It has got a high sodium and chloride, and it has got a low potassium. So what is high? Proteins are high, sodium chloride is high, vitamin A is high. What is low? Fat is low, carbohydrate is low, potassium is low, and it is rich in immunoglobulin. Okay, it is rich in secretory IgA. Okay, so this is what is the composition of the colostrum, which you should know. Deep yellow color, serous in consistency, alkaline in reaction, high specific gravity, high protein, high vitamin A, sodium chloride, sodium and chloride content is high, low fat, low carbohydrate, potassium is low, but immunoglobulin such as IgA content is very much high. So what is the microscopic feature? So if you check this under the microscope, you will see lots of fat globules. Then colostrum corpuscles will be there. These are nothing but the large polymorphonuclear leukocytes containing the fat globules. Okay, so these are the colostrum corpuscles, which are large polymorphonuclear leukocytes containing the fat globules, and acinar epithelial cells are also present. Okay, so we should compare, if you compare this colostrum with the breast milk, then the composition of the colostrum is different, composition of the breast milk is different. Just now we have seen it is very rich in protein. Okay, as compared to the fat and carbohydrate, protein content in the colostrum is very high. Okay, so protein content is around 8.6 in the colostrum, while it is 1.2 in the breast milk. Fat content is 2.3 for the colostrum and 3.2 for the breast milk. Carbohydrate is 3.2 for the colostrum and 7.5 for the breast milk. Okay, so if you see here, the protein content is high. If you see in the breast milk, it is the carbohydrate content is high. Okay, and water content is almost similar for both. Okay, what are the advantages of colostrum? First thing, secretory IgA, it is rich in immunoglobulins, IgA type immunoglobulin that provides local mucosal immunity. IgG and IgM will give passive immunity. Lactoferrin has got an antibacterial action, and there are large fat globules which will have the mild laxative effect, facilitating the passage of the meconium. Okay, so these large fat globules will have the laxative effect so that the passage of the meconium will be facilitated. Then physiology of the lactation. The physiology of the lactation will consist of 4 phases. These are the 4 phases which are expected when you are writing a question. So these 4 phases are mammogenesis, lactogenesis, galactokinesis, and galactopoiesis. Mammogenesis. Mammogenesis is the preparation of the breast for the lactation. Lactogenesis is the milk synthesis. Galactokinesis is the secretion of the milk or the milk ejection, and galactopoiesis is the maintenance of the lactation. So these are the 4 things which you have to describe along with its hormonal control. So mammogenesis, development of the breast, which is happening under the influence of the estrogen and progesterone. It happens during the pregnancy. Then lactogenesis, that is the synthesis of the milk This also is there during the pregnancy, and it is under the influence of the prolactin. Galactokinesis, that is the ejection of the milk, is under the influence of the oxytocin. And galactopoiesis, that is the maintenance of the lactation. Again, prolactin is the hormone which is responsible. And then you have to describe these 4 phases in detail if it is a full question. Okay, so first phase is a mammogenesis. Mammogenesis is nothing but the preparation of the breast for this lactation. Okay, so what is happening in the breast? There is a development of the ductal and lobulo-alveolar system during the pregnancy, and major hormones responsible are the estrogen and progesterone. And remember, nerve supply is not essential for the breast development during the pregnancy because it is under the influence of the hormones estrogen and progesterone. Okay, so ductal development mainly under the influence of estrogen, and this lobulo-alveolar is under the influence of progesterone. Okay. Then lactogen. Second phase is a lactogenesis. That is the milk synthesis. Okay. Lactogenesis is a synthesis of the milk. Okay. It's not a secretion. This is a synthesis. Okay. So lactogenesis is the milk synthesis by the alveolar epithelial cells. So what are the important features? So there is an appearance of the colostrum. Generally, it begins in the latter part of the pregnancy, but mature milk will get secreted by around 3rd or 4th postpartum day. Breast changes, the breast will become engorged, tense, warm, and tender. The main hormone responsible is a prolactin, and other additional hormones such as glucocorticoids, growth hormone, insulin, and thyroxine, they are also equally important. Then suckling is required for the initiation of the lactogenesis. Is it required? For initial initiation, it is not required, but definitely for maintenance, it will be required because it is under the influence of the prolactin. Even during the antenatal period, the synthesis is happening, but ejection is not there because estrogen and progesterone level, they are opposing the ejection. Okay, so there are high levels of the prolactin and even high levels of the estrogen and progesterone in the antenatal period. But after the delivery, the estrogen and progesterone is levels are low, but the prolactin levels are high. And in the initial phase, the suckling is independent. So it is an independence of suckling. There is an initiation of the milk secretion, but further suckling is required for maintenance of the lactation. Okay. So what happens with the suckling? So when the baby sucks or the nipples and the areola, the signals are sent to the hypothalamus, mainly the T4 and T6 via the afferent. The impulses will go to the hypothalamus and pituitary, and the hormones which are secreted are the prolactin and the oxytocin. This prolactin will act on the this prolactin will act on the alveolar cells, and there will be milk synthesis, that is the production of the milk. Along with prolactin, other hormones such as growth hormones and insulin, these are, and thyroxine, these are also important. Then the suckling will also cause the secretion of the oxytocin, and these oxytocin will act on the myoepithelial cells, and that will cause the contraction of these myoepithelial cells, and it will lead to the milk ejection. Okay, so this oxytocin will also have the effect on the uterine musculature, and it will lead to the uterine contraction. Okay, so this is what is the effect of the suckling. Okay, so why the milk is not secreted during the pregnancy? So what happens during the pregnancy? There is a high estrogen and progesterone level. The breast becomes unresponsive to the action of prolactin. Okay, so milk secretion is inhibited because of the high levels of estrogen and progesterone, and because the breast is not responding to the prolactin because of the high levels of these hormones. But at the time of delivery, the placenta is expelled, estrogen and progesterone will fall, and the prolactin will act on the mammary alveoli, and there will be secretion of the milk. By around day 3 to day 4, the lactation will be established. Now, third phase of lactation is the galactokinesis, that is the milk ejection reflex. Okay, so it is the movement of the milk from the alveoli into the lactiferous ducts. So major hormone here is a oxytocin. Okay, so galactokinesis is mainly oxytocin, while milk synthesis is under prolactin. Okay, so galactokinesis is a milk ejection, and this is mainly a major hormone is oxytocin. So milk let down reflex. What happens when the baby sucks? The nipple and areola get stimulated, and the impulses will travel from T4 to T6, that is thoracic sensory nerves, to the hypothalamus, which nuclei, the paraventricular and supraoptic nuclei, and there is a secretion of the oxytocin from the posterior pituitary, and that will lead to the contraction of the myoepithelial cells, and there will be secretion of the milk, that is the let down reflex. Okay, and that is how the baby receives the milk. So in the puerperium, two reflexes. One is a milk let down reflex, and another two hormones basically. One is oxytocin hormone, another is a prolactin hormone. These two hormones and milk let down reflex we should be able to write. Okay, so milk let down reflex is oxytocin mediated. Okay, then draught, it is a sensation of breast fullness at the beginning of the feeding. Then there is a conditioned reflex. So it is not only the suckling of the baby, but the infant's cry or even seeing the baby may also initiate the milk ejection. That is the conditioned reflex. Okay, and oxytocin ejection can also, so parentally also, if you give oxytocin, if there is a, sometimes we give, can produce the milk letdown. Okay, so what are the factors which are inhibiting the milk ejection? These are the factors such as pain, anxiety, emotional stress, breast engorgement. The next or the last phase is the galactopoiesis, that is the maintenance of the lactation. Okay, so maintenance of the continuous milk production. The principal hormone here is again a prolactin. Okay, so this, the essential stimulus is a regular suckling. Okay, for maintenance of the lactation, the breast should be completely emptied more frequently by suckling. Okay, so mechanism is a milk removal stimulates the further prolactin release. Okay, and if there is an infrequent feeding, there is an accumulation of the milk, and that suppresses the milk production. Okay, so what is the mechanism for galactopoiesis? It is under the influence of prolactin. So frequent breastfeeding will lead to the prolactin secretion. There is a continuous milk synthesis. The breast is emptied, and the further milk production is there. Okay. So how much is the milk production per day? Approximately around 500 to 800 ml per day. How much is the caloric requirement during the lactation period? Around 700 kilocalories over and above the normal. And the fat reserve which is required during the this period is around 5 kg. That much is the fat reserve which is required during the lactation period. Then what are the factors which will stimulate the lactation? Okay, so the most important is the antenatal IEC activities, or motivate the mother during the pregnancy, that improves the breastfeeding success. Avoid pre-lacteal feeds. Okay, so if you give something pre-lacteal to the baby, definitely there will be decrease in the breastfeeding. So that will delay the breastfeeding. So you have to start the breastfeeding as early as possible. Within half to 1 hour, the breastfeeding should be initiated. Feed baby every 2 to 3 hourly. There is a maintenance of the milk production. Encourage exclusive breastfeeding. It improves the neonatal nutrition. Adequate fluid intake, maternal fluid intake should also be adequate, and it supports the milk production and prevent the breast engorgement. It ensures the effective feeding. Okay. Then sometimes there is a lactational failure. What are the causes of lactational failure? It may be infrequent suckling. Then that leads to the reduced prolactin stimulation. Use of ergot preparations also decreases the prolactin or the suppresses prolactin. Pyridoxine decreases prolactin. Diuretics will reduce the milk production. Retained placental tissue, because of the persistent estrogen, will inhibit the lactogenesis, and pain, anxiety, insecurity will inhibit the oxytocin release. So management of the lactation failure. First thing, frequent feeding. Every 2 to 3 hours, the mother should feed the baby. The correct attachment is very important. Adequate maternal hydration is important. Then treat the maternal anxiety. Avoid unnecessary supplementation and remove reversible causes. Okay. Routinely galactagogues, that is the drugs which increase the lactation, routinely not required, but if required, the metoclopramide, which is a dopamine antagonist, that acts by increasing the prolactin, because it is a dopamine antagonist. Okay. Then next is a sulpiride. That is also dopamine antagonist, and another is a intranasal oxytocin that facilitates the milk ejection. Okay. Sometimes we may have to suppress the lactation under certain circumstances. And what are the indications for lactation suppression? Indications are stillbirth, neonatal death, contraindication to the breastfeeding. If the mother has opted for it, say for example she is on ART, and or if she is on some anti-cancer or some therapy, then there may be contraindication also, or it may be mother's choice. Okay. Then what are the non-pharmacological methods? We should promote the non-pharmacological methods mainly. Okay. First, stop the breastfeeding. Second, avoid breast pumping. Third, give the breast support. Ice packs can be used. Analgesics and compression bandage for 2 to 3 days. As far as possible, avoid drugs. So drugs which are not recommended are bromocriptine, because it causes hypotension, seizures, myocardial infarction, puerperal stroke, and rebound lactation. So these are the side effects of the bromocriptine. Estrogen androgens are also not recommended. If required, you can use a cabergoline, which is relatively safer as compared to these drugs. Okay. Then breast milk for premature infants. Okay. So even if you see the premature baby, and if you see the composition of the premature milk, that is different from the mature milk, because in the premature, the GIT as well as the renal system, they are not well established. Their function is not well established. So it is a, from nutritional point of view, it is easily digestible. Not only that, the baby is prone for infection. So immunologically, it is important. It gives better infection protection, and metabolic is very important for the premature baby, because there is not a much metabolic load on the kidneys. There are less chances of azotemia, hyperaminoacidemia, and metabolic acidosis because of this premature milk. The composition is such that it gives less load to the kidneys. Okay. Not only that, it improves the psychological maternal and infant bonding also. Okay. So from Viva point of view, certain things which you should know: colostrum is rich in secretory IgA and vitamin A. Mature milk secretion begins on around third or fourth postpartum day. Prolactin is important for milk synthesis, while oxytocin is important for milk ejection. Milk ejection is inhibited by pain, anxiety, stress, and breast engorgement. Frequent suckling is the single most important stimulus for maintaining the lactation. Average milk production per day is around 500 to 800 ml per day, and lactating mothers require approximately 700 kilocalorie per day as an additional energy over and above the normal. Okay, so that finishes the today's topic of lactation. Thank you.